if I could invite you to talk about our health challenges as we go forward.
Yes,
thank you, Stephen.
Yeah, well, thank you very much indeed. And of course, all this discussion we're having about air pollution at the moment, both at your conference and everywhere else, is focusing really on the health aspects, the human health aspects. That's not to say there aren't major environmental and other issues to consider, but I think the human health aspect has come to the forefront in the last couple of years. And I think the health evidence that's been accumulated over this period of time has really strongly reinforced that. So what I'll do, if I may, is to share my screen, or have you got my slides? Host disabled participant screen sharing is what I've got. That means I can't share my slides. Nathan, can you enable me to share my slides?
No, I'm afraid, I'm sorry, we've had technical glitch on that. We can't share your slides. I'm very sorry, but can you just talk to your slides, and then we would circulate to delegates afterwards. So I'm very sorry.
No, it's all right. No, it's no problem. So you won't be able to see what I'm talking about, I assume. So that's all right. Don't worry. Well, look, it doesn't really matter. I mean, I think the important thing at this last kind of presentation really is to think about where we need to consider activities into 2022 and beyond. And I think the first thing I'd like to state is that it's really only in 2018 that the World Health Organization had their first global conference on air pollution and human health. And that's extraordinary when you think about it. It's only 2 or 3 years ago. So obviously a lot's happened since 2018. The point they really wanted to make, and I think this is a really important point, is that outdoor air pollution contributes as much adverse health effect and increase in mortality worldwide as active and passive smoking put together. And it's far more than many of the other environmental and personal factors that influence human health, such as high glucose or sodium intake or alcohol or high cholesterol. So we're talking here, about one of the greatest impacts on human health. And I don't think personally this message has got across properly yet, the magnitude of the effect of air pollution on human health right across the life course. The second point I want to make, and this has come from these massive epidemiological studies that have taken place, one in the United States with over 60 million people participating in the Medicare study. When they look at the hazard ratio for all-cause mortality, irrespective of what people died from, in relation to particle concentrations or gas concentrations emitting from pollution sources such as nitrogen dioxide or ozone, the line passes through zero. In other words, there is no safe level of air pollution. And I don't think, again, that message has probably come through strongly enough. People still talk about plateaus and limits as if once one reaches that point, the health effects are sorted. And that clearly is not the case. So that's the second point I wanted to make. And the third, in relation to human health, comes through when one looks at the populations within countries that are most adversely affected by bad air quality. And those are those that are disadvantaged, and those that are in the racial minorities, and those that are living with low income. So in other words, those that can least protect themselves against the adverse health effects of pollution are those most affected. And again, there's a social injustice here that needs to be thought about. And it's interesting looking at the recent report that Asthma UK and the British Lung Foundation released. It's called Clear the Air, Improving Air Quality to Protect Future Generations and Level Up Our Communities. They point out clearly that we've got to think beyond the acute effects of air pollution, where a lot of the public still are stuck in the concept of what air pollution is, and move towards the idea of long-term cumulative effects of poor quality air across the entire life course, from conception to old age. And I think this again is a message that we need to push out very strongly. Just as with tobacco smoking, the more you're exposed to over time, the worse the damage to the various organs in the body. And by various organs in the body, I mean all organs in the body. So again, we have the view that air pollution is just a lung or a heart problem, but it isn't. It affects the brain, it affects bone growth, it affects the metabolism of sugar in patients with diabetes, it affects blood pressure, it affects the time when women give birth to their children, it affects the size of the organs in the child that's born, it affects the central nervous system and the cognition. So we're talking here about pollution influencing all the organs in the body. And therefore, we have to think that this is something of interest to the health and medical professions broadly. And so what I would say as a health practitioner is that interest in air pollution by medical and health practitioners needs to change and needs to be much stronger than is currently the situation. And when we heard, as you will have talked about in the last day or so, about the WHO new guidelines, it's fascinating to see that for both particles and NO2, that the levels that are being predicted here of being targeted by countries to try and clean up the air are now substantially lower than the levels of air pollution we currently have in this country. 5 micrograms per meter cubed for PM2.5 and 10 for nitrogen dioxide. So there's a long way to go yet before we can say that we've really started to make serious inroads into influencing the environmental adverse effects of air pollution on health. And this came into very sharp focus, as many of you will know, in the relatively recent second inquest of the little girl Ella Roberta Adu Kissy Deborah, who died of asthma in 2013. And during that inquest, which her mother requested on the basis of new evidence, it was quite clear that air pollution exposure not only was involved in helping generate the environment which led to little Ella's premature death from severe asthma, but also contributed to the onset of her disease and its progress over the 2.5 years that she experienced it. And of course, what happened at that inquest is that Philip Barlow, the assistant coroner for Inner South London, stated that this was of such importance that this single human being who had died because she was so at risk of the adverse effects of air pollution, he said that this had far-reaching consequences for other people and other cases. And I think what this really points to is that, yes, we can generate any number of p-values and numbers, but what really counts at the end of the day is what air pollution is doing to individual people. And I think what we should be trying to do as a medical and health community is to bring forward other case stories where air pollution is adversely affecting human health, because it helps the public understand why this is such an important thing to engage with. And as a result of that inquest, of course, he came up with the Prevention of Future Deaths report, in which he stated, firstly, that here in the UK, we should stick to legally binding targets based on WHO guidelines, and they were the old ones, not the recent ones in 2021. Secondly, that we need monitoring to improve across the UK so that greater awareness of what pollution levels individuals are exposed to could be put into the public domain so that people can make decisions about where they wanted to go or not want to go, and put pressure on their local authorities and local government to improve the air. And thirdly, and this is where I come back to the health and medical professionals, to help educate. We need greater education of the medical profession about the serious effects of air pollution on human health. And these are things in 2022 that we've really got to try and achieve, because obviously this loss of this little girl's life pointed a light on this. So just returning to the Asthma UK, British Lung Foundation Clear the Air report, they in this report said that 2 in 5 babies are born every year in areas with toxic air. That's nearly 30% of hospitals in England are located in polluted areas above the 2005 WHO guideline, not the recent one. They also point out in this report that air pollution is highest in areas with levels of deprivation and those with lowest incomes, which is what I've made. The other thing I just wanted to mention towards the close of my talk is the importance of indoor air quality. You know, we spend just about 8% of our time outside in this country, which is less in winter than in summer for obvious reasons. So this means that the indoor air that we breathe is clearly of great importance in terms of a source of exposure. And yet we know relatively little about this. And this is why with the Strategic Priorities Fund UKRI Met Office research program that I and 2 of my colleagues are Clean Air Champions for, we are in wave 2 rolling out a series of exciting new projects to understand what the indoor air quality is and how it's adversely or not affecting human health. And I think over the next year or 2, we'll have some exciting new information to be able to tell you. But the reason why this is so important is that for the younger generation, we could almost say now this generation is the indoor generation, that the way that we are conducting our lives mean that children do not get the exposure to the wider environment that they did during my childhood, and that children are obviously, in the way that technology is drawing them into the indoor space, really getting a different type of exposure than we were used to having. And of course, with climate change coming down the pike that we've been talking about at COP26 in this last couple of weeks, the indoor air becomes even more important as we tighten up our homes, sometimes forgetting that we have to increasingly ventilate them to get rid of the pollutants that accumulate in them. And that's why I think I was a little saddened really at COP26 that there wasn't a health component of that conference. I know one can't cover everything, but it's really important that as we move towards climate change benefits and zero carbon, that we think about the health benefits that can be gained by cleaning up the air, because that is the lowest hanging fruit to some extent in getting the air quality, in getting the climate change targets achieved. But maybe as we go into next year, we can hitch a lift on the back of COP26, whatever comes out of that eventually, and put the health agenda back. The Clean Air Fund, which I have great admiration for, came up with their report, Joined Up Action on Air Pollution and Climate Change. And again, they reinforce on a worldwide basis why cleaning up the air and at the same time benefiting the climate change agenda is what we should be doing together. And we must be exploring, as I know you are at EP UK, the co-benefits that can be achieved by doing these things together. And I hope as we go into 2022, we can bring this more clearly to the forefront. So finally, I'd like to just suggest as we go into 2022, we look at a few particular targets. Let's use this levelling up agenda to ensure that during 2022, that the air that all of us breathe is cleaned up, and that we continue down this wonderful road for making it a human right to breathe clean air, just as we have the right to drink clean water. We need to have bolder clean air laws, and we need to have clean air prioritized in transportation and decarbonisation strategies. We need to ramp up the funding of public transport, because this is where we're going to obviously get the cars and other vehicles off the roads. And we need to promote, as is happening, but we need to promote more walking and cycling, as they have done in some of the other European countries. And finally, and I think importantly, and I think EP UK has a big role to play in this, we need a public health campaign on air pollution. We need something that brings this topic to the forefront of the public as being something that is not all unpleasant. It's not all about charging more, but it's about improving our environment for the benefit of all. Don't forget, if we do that, we've got not only a moral case, but we've got a fairness case, and we've got a health case that will all benefit as a direct consequence of doing that. And just think of the lives and the morbidity from different diseases that will be saved. Over an 18-year period, a 1 microgram per meter cube reduction in fine particulates will prevent 51,000 coronary heart disease cases, 16,500 strokes, 9,500 cases of asthma, and 4,500 new lung cancers in non-smoking lung cancer. So, you know, the yield from this would be substantial. So I'll end at that, if I may, and thank you all very much for allowing me to maybe trade my particular biases as to why I think 2022 needs to continue to be the turning point for change. Thank you very much.
Thank you very much, Stephen. I think we'd like to take some questions, and then you're welcome to stay with us because we're almost at the end of our conference, but we're most grateful for that reflective thoughts of your ideas of the future that we should all think about on our way home. I'll take some questions.
Yeah, hello, Stephen. It's Gareth Simpkins from the ENDS report here.
Yeah,
regarding, hello, sorry, we don't know each other. Yeah. Regarding the assistant coroner's report,
yeah,
there was a lot of hope that that would have an impact on policy.
Yeah.
And then DEFRA came back with a, let us say, somewhat disappointing response to it. So what has been the practical policy impacts of his report?
Well,
and do you see that improving over time, perhaps?
Yeah, thanks very much. Yeah, so I think it's a little early to say exactly what those benefits will be. What I intend to do, working with the Royal Medical Colleges, once we get through this COP26 period, if I could use that term, early next year, is to bring all of the people to whom that Prevention of Future Deaths report was addressed. And of course, it's not just the central government, it's peripheral government, the Royal Medical Colleges, the training of doctors, etc., and to actually ask them precisely what is now happening as a result of those recommendations. You can bet your bottom dollar that Rosamund Kissy-Deborah is going out there now as the World Health Organization ambassador for air pollution, absolutely holding the feet of the government to the fire to ask what's happening. So I think in 2022, let's just see whether we can actually get some movement here. My sense is, and I'm saying this off the record, if you don't mind, my sense is that yes, there is now a different conversation beginning to happen. And I'm saying that because within DEFRA, for example, they're setting up the new sort of panel to look at the air quality index and to refine that. And if I look at the people they're now involving in all of that, it's a much wider community of people, including the public in general. So I'm not as pessimistic as that. I think it was December last year that we had the inquest. It was April this year that we had the Prevention of Future Deaths report coming out. Let's just use 2022 to see whether we can actually pull a few more levers and get more action down the same road.
Any more questions? No. Yes, we've got a question from John Merlis.
It's John Merlis. Thank you, Stephen, for that talk. It's saddening in a way, but also I think it's very encouraging that there are actions that can be taken. I guess from EPUK's standpoint, it's a question of setting priorities. And it's quite a list of challenges there. I wonder if you could give us some sense of priority in where we might direct our fire in 1922 and beyond.
Yeah. Thank you for that impossible question. I love it. I think basically is to get health higher up the agenda in the discussion about all of this, really. I mean, air quality is stuck with the environment for the last 150 years. But in fact, the issue is a health issue. And of course, you know, DEFRA and Environment Agency and other organizations involved in measurement and compliance and all of that is fine. But unless we get the medical community and the health community more positively engaged in this, just as they were with tobacco smoking, I don't think we are going to be able to move the dial very much. Because, you know, they are the trusted messengers to some extent, your GP in your local authority, or the doctor treating the heart disease in the hospital, or treating the child with asthma. So, you know, if we could, if I have, my top priority is to connect up with some of the excellent work that EPUK has been doing on monitoring and on making sure that we understand more about the environmental effects of air pollution, but making sure it connects with the health. And then once we've got that better framed with a language that's more positive than negative, to go out with a public health campaign, which is what I said earlier on. And I know EPUK did attempt to do this a year or two ago, and I admired them immensely for that. I think we're ready for another one, to be quite frank. I think the reception would be very different now than it was 2 or 3 years ago. And I would like to see EPUK give that very serious consideration. But to do it in partnership with the third sector involved in health and medicine, and with other organizations such as those that are willing, I think, in local authorities to use their sort of case studies as examples of how things can be done.